Hi, I'm Dr. Ajani. Today I'm addressing an issue that I hear from a lot of clinics and a lot of patients. As many of you know, I get to travel around the country and see a lot of practices, a lot of different models, and it's very interesting to see what's working and what's not and what are some of the struggles. One of the common themes that I hear not only from patients but from the clinics are corrections of Botox and filler. And this is not uncommon, and I think there's some misunderstanding about it. And so we'll talk about it today. And I think a lot of calls that clinics get might be, hey, I need a correction of my Botox or my filler. Or they went to a different clinic and they want to come to another clinic because they want it corrected. And as we fine tune and as we're treating areas that we traditionally didn't treat, such as the lower face, such as the forehead, where people are more and more aware of their brow shape, they're playing with their brow shape. The forehead's a tricky area to inject, especially as people age. The eye gets extra skin and we tend to get sag. 10, 15 years ago, we used to use 20 units of Botox in everyone's forehead, and we lowered them and it was just fine. We're so attuned to brow shape, and as we have an aging population, there's more hooding above the skin. Now, the average is about 12 units in the forehead. The lower face, where it's very particular for both filler and for neuromodulators such as Botox and Dysport, especially the first time patients get it, it can feel a little bit funky. The mouth can move in not exactly the way the patient wants because the muscle fibers are strong and then we've taken away the movement. So with fillers, it's the same thing. We're filling areas that are tricky, such as the under eye, one of the most difficult areas to inject. And imagine trying to get that 100% correct on one injection session. So my point is to let people know, and injectors and clinics, to understand 10 and 15 years ago when we started doing this, we saw everyone back at 2 weeks no matter what, because we wanted to see what the effect was, we wanted to fine tune it, but we're in an instant society now. And people believe that we should be able to come in and get these treatments and they should be 100% right every time without any follow-up or fine tuning, especially those tricky areas. There are areas that your injector is looking at that there are muscles and aberrancies of those muscles, meaning that the muscles in one person are going to be slightly different than the next, and the anatomy is a little bit different, and we have to get to know our patient. But that's what's separating the clinics that are succeeding from the clinics that aren't, is those nuances and fine-tuning our patients to get exact results. So it's not so much, oh, I need to correct something that was done wrong. It's more the artistic eye of it, the variability of sometimes the product and also our human body and our body's response, and fine-tuning it. Why we don't see everyone back at 2 weeks is patients just are unable to maintain that now. It's an instant society, everything's quick, in and out, and if patients look perfect, they don't want to come back for that 2-week visit. So a lot of clinics struggle. There'll be a lot of no-shows if clinics did that and saw everyone back in 2 weeks. We would love it as clinics because then we get a chance to re-engage the client. It's just not possible in today's fast-paced world. So for Botox, filler, and other similar aesthetic corrections, keep in mind that it's very common to get a follow-up appointment. You're not bothering your provider. In fact, your provider most likely would love to see you back. And for clinics, understand that yes, getting these treatments right, 100% right on the first time in such delicate areas, especially in newer patients, is very difficult. And even in long-standing patients, of course, the muscles atrophy and change from year to year. So someone who maybe tolerated 15 units of Botox in the forehead, 1 or 2 years later, they won't tolerate that because of the downward fall of the forehead, extra skin above the eye, or hormonal changes in that time period that have thinned the skin and made some changes. So it is a bit of a moving target. Work with your provider continually to get perfect results. Follow up as needed. I hope this video helps answer some of those questions. Join us here, subscribe to this channel, or like us and join us on Facebook for continued helpful tips. Keep your skin and body beautiful, healthy, and vibrant.